Welcome, everybody, to the fourth annual PAS Lead RSJ Conference. As you know, PAS Lead stands for Leadership, Equity, Anti-Racism, and Diversity. Today, the PAS Lead directors are me, my name is Salma. We have Sarah, Sabrina, Michaela, Danielle, and Ayana. So PAS Lead started as a group of PA students of color and their allies that formed out of the May 2020 PAEA Town Hall anti-racism discussion in the wake of Floyd's murder. So RSJ conference is the racial and social justice conference. So it's the presence of racial and social injustice, implicit bias, and racism in the medical practices and policies are all issues that cannot be distributed. So if you pair that with the lack of diversity in healthcare professionals and the deficit in proper education regarding cultural competency and cultural humility, we have to consider how the variable affects the minority patients and their health outcomes. So our RSJ conference is an opportunity to gain knowledge and the ability to identify and stop racial and social injustice on the front line, specifically in the medical field. So this year's topic is the implicit bias and its impact on patient care. It's a critical issue that affects health outcomes and the quality of care provided to diverse patient populations. Unconscious biases can lead to unequal treatment, misdiagnosis, and healthcare disparities. For an example, minority patients receiving inadequate pain medications and pain management or delayed interventions. Addressing these biases is essential for achieving equity and upholding the ethical values of respect and compassion in healthcare. Physician associates in general, with their patient-centered approach and advocacy for systemic change, are uniquely positioned to play a key role in reducing the impact of implicit bias and improving patient care for all. I'm so excited to share with you our first speaker. Sabrina, if you can introduce our first speaker, please.
Good morning, everyone. So I have the honor of introducing our first speaker, who also happens to be my great aunt, Dr. Joycelyn Elders. She is the first African-American and only the second woman to serve as the U.S. Surgeon General. She was a pioneering advocate for public health. Born in 1933 in rural Arkansas, she overcame poverty and segregation, becoming the first person in the state to be board certified in pediatric endocrinology. After earning a scholarship to Philander Smith College, Dr. Elders joined the Army, then attended the University of Arkansas Medical School. She went to have a distinguished medical career and rose as a professor, researcher, and pediatric. Dr. for advocating sexual health education and expanding public health initiatives. Before that, as Arkansas's Health Department Director, she pushed for sex education, immunizations, and improved prenatal care. Despite opposition from conservatives, her groundbreaking work helped shape national policies on adolescent health, sexual behavior, and reproductive rights. Please help me welcome Dr. Joycelyn Elders.
Good morning. It's a real pleasure for me to be able to talk to the PA students, especially here in Arkansas and around the country, and to increase your awareness of problems, implicit and explicit bias in healthcare, and to increase your overall awareness of healthcare. I feel that you will be the group who are delivering most of the primary care that will make a real difference to people all over this country. And what we need to be worried about is being healthy. So the first thing we need to do is talk about What does it mean to be healthy? Healthcare is more than absence of disease. It's related to our jobs, related to our homes, related to our employment, related to the kind of education we have. And all of these things go to make up a healthy environment. So we've got to, it's more than free from disease. It's not displaying clinical signs of infection. It's beneficial to one's physical, mental, and emotional health. To be healthy implies full strength, vigor, and freedom from malfunction. We have to be free from medical and mental disease. What are the roles of healthcare providers? What is your role in health? What is that? We have both explicit bias and implicit bias. Explicit bias is when we're consciously aware of the bias that's going on. We know we're biased in our thoughts and emotions toward a specific group of people. We know that. This can be seen in hate speeches, discrimination, and sometimes just prejudice. Whereas implicit bias is that bias we have that we don't know we have. It's our unconscious attitudes and beliefs that affect a person's feelings, behavior, or judgment without their knowledge. When we think about how its implicit bias is formed, it can be subconscious generalizations, a broad assumption about a group of people based on limited information. We've all done that. We say we haven't, but we have. Subconscious generalizations also appear natural. Stereotypes, implications that all people or members share the same characteristics regardless of individual differences. Like we may feel, well, all Black people are the same, all Hispanic people are the same, but we know that they aren't. Stereotypes are harmful generalizations that are resistant to new information. You know, we have all these stereotypes, and sometimes we resist more information. Compartmentalization. So we can form implicit bias, subconsciously, stereotypes, or compartmentalizations. This is a cognitive stereo that's intended to make it faster and easier to make judgments or take action. Implicit bias is a form of becoming more inefficient. So we feel it's all right to have our implicit biases by someone. And it's more likely to occur in high pressure, time sensitive situations that require a lot of multitasking, like what you'll be doing for the rest of your lives. Implicit bias leads to a lower quality of care. You need to know that. We have incomplete patient assessment, minimized environment in patient care. We lack of thorough testing. We don't ask all the right questions. And B, for this inappropriate diagnosis and treatment, insufficient follow-ups and referral. So we know that this occurs. That's when we have implicit bias. We feel we don't need to do all of this because, oh, Mr. Jones, he's old, he's Black, he's whatever. It's whatever our implicit biases about certain people. It destroys trust. Providers have become unaware of their prejudices. We are biased and we don't even realize that we don't take the same care of. Our behaviors and our languages are different. We offend. It often offends, harms, and marginalizes patients. Because of that, the patient stops seeking health care. If you aren't marginalized, if you're marginalize them and not taking them good care, patients feel disrespected, unconfident, and lose trust in providers. And that because of that, they accept unhealthy lifestyles. It's all right to not eat right, not get the blood pressure taken. And so they have erosion of provider-patient relationships. You wonder, well, why didn't they come back to see me? Why? It's because you may need to look and see what you've done and look at what's happened. And in order to take action, you've got to increase your self-awareness, educate yourself with self-assessment, and identify potential biases. Identify your own biases. Practice mindful decision making. Seek diverse precepts. Intentionally engage with people from different backgrounds and cultures to broaden your understanding. What do you do when your relationships with your colleagues are eroded by implicit biases? Speak out. Express your feelings frankly and publicly. Draw attention to the fact, announce them, and accept the fact when someone tells you, accept it. So you need to identify the issue, gather all the information, choose your platform and your audience, practice your delivery, prepare for feedback. You have to get people's attention before you can achieve change. If they aren't aware of it, they can't change. You have to take a stand and say, this is where I am. People are either going to love you or hate you, depending on what's going on. Not everything in life will go your way. You must accept defeat so that you can build and start again. So I think you need to really begin to think of your own biases, what you can do to make a difference, how you can change, what you can change, and listen, don't just get mad and upset when people tell you you have these biases. Start examining yourself and your own thoughts from within to make sure that this is not what you're doing. I want to thank you for allowing me to talk with you, and want to know if you have any questions that I can't answer, but I will try. Thank you.
Thank
Okay,
you
better.
so much, Dr. Elders. I actually have a couple questions for you that we kind of got from our social media accounts. People were interested. One of the first questions is, can you share examples of how implicit bias manifests in healthcare settings, even among well-intentioned providers?
I think we might be running into technical difficulty. If you guys can just bear with us a bit. In the meantime, you guys can feel free to jot down any questions you may have to Dr. Elders in the chat.
Okay. Okay.
Dr. Elders, would you like us to repeat the question for you?
Yes.
So the first question was, can you share an example of how implicit bias manifests in healthcare settings, even among well-intentioned providers?
I feel that unintentional bias manifests itself in healthcare settings by assuming all people of certain races or genders are the same, and they are not. Assuming that all Black people, let's say, eat lots of salt or eat excessive amounts of, of fat, rather than giving them the appropriate kind of diet, they should make sure that they manifest themselves as the individually. You should treat each patient individually and respect them for what they are, and take a good history from them. Ask what they want and they do and what they would like. And often we find out many things that we really didn't know, and we find out we have many wrong concepts.
Thank you. Let me see. The second question. How do you recommend people speak up when you notice something is being biased?
I think when you notice something that's being biased, you just speak up and say something about it. You may not have to speak up to them. Let's say if you decide that this is, you don't want to embarrass somebody or say something before a large group. Let's say, however, I have, but you can afterwards say, I need to, let me talk to you about this, and bring it up to them, because they may not even be aware that they were being biased. But sometimes you can ask a reverse kind of question. And the most embarrassed I ever was when I was an intern, and they were presenting the information and talking about this doctor who had really made a very terrible mistake, if you will. But that was because I was in a university setting where I could get everything immediately and get answers. And well, he was in a rural area where there was no one else around, and and I was saying, well, this doctor shouldn't have done this and shouldn't have done this. And a doctor said to me, he didn't say anything to me, he just made the comment that was in a big room. He says, people who live in glass houses shouldn't throw stones. Do you know that stuck with me forever? And you don't always know the circumstances which bring about a particular reaction, and I didn't know any of that, but I was just an intern, and I was blabbering, about a doctor in a very rural, remote area that I knew nothing about.
Thank you,
So I
Dr.
think
Elders.
go ahead.
We have a question from Nathan in the group here. Nathan, if you wanted to unmute.
Hi, Dr. Elders. Thank you very much for speaking.
Hi.
You had some amazing things that you said. Well, I know that we're talking about implicit bias in healthcare, but I had a question about, with you being the first African American Surgeon General back in the early 90s, did you experience implicit bias from some of the folks in leadership around you, and how did you handle that in such a way that was, as you say, being respectful, but not, calling people out and making them feel bad about it? Because
Right.
as we've talked about implicit bias being, unconscious bias more than, overt bias and prejudice.
Well, yeah, I think, that it depends on what the situation is, but we have different ways that we can make people aware. We don't have to, you may not correct them or change them at that time, but you can make them. I remember doing my confirmation hearings. I had a doctor, and I don't think he really meant to be harsh, but I had taken care of my mother-in-law. Just taking care. We were taking. She was living with us, and I was, providing health care. And so he was asking me other kinds of questions, and he made he said, well, he talked about how awful and disgusting, and I talked about it, and I just, I said, doctor, you said that. I said, I did not. I just had him understand that was not what I had said at any time. And I said, I took care of my mother-in-law because I felt a feeling that this was what needed to be done and what I wanted to do. And I said, I never felt that I was being put up on or that it was against me. And I said, maybe that's how you felt. I said, it was not how I felt.
Thank you. Yeah, I think that's very important. Like, just because one person might feel some way doesn't mean that the person that's doing the action feels the same way.
That's right. And it may sound like, and something that may sound like a horrible job to you may not bother me, but something may be, I think, is a horrible job. You hear about it, you may not think much of it, and I think that we carry around sometimes some of these implicit biases that we don't necessarily mean. And I think that everybody was always asking me, well, how did being poor and Black and from the South, how did you get to be Surgeon General? They just couldn't figure that out. And well, so I think that you have to accept that, that I was poor and I was Black, but I worked hard, I studied hard, and I didn't go around with a chip on my shoulder that I couldn't do it because I was poor and Black.
Thank you, Dr. Elders. Let's see, we have another question from the participants here. Iva, would you like to unmute and ask your question?
Yes, thank you so much, Dr. Elders. I agree that was a very informative and like a heartfelt presentation you gave. You were such an honor to have here. But I wanted to ask, how did you ever deal with implicit biases from the other end, like with any of the patients that you encountered, being a Black woman in such a high position? How did you deal with that in a respective way and still provide them with, best patient care.
Yeah. I think you asked me how, dealing with older white men. Yeah, first of all, they couldn't believe that they had to accept the fact that I was a doctor. First of all, they had to accept the fact that I was a Black person. Then they had to accept the fact that I was a woman doctor, and that I could be their doctor. So I think that was, so you had to go through all of that. But I think that was just, I had worked very hard to make sure that if I was their doctor, I wanted to be a very good doctor, and I wanted them to feel that I was the best doctor they'd ever had. And so that meant that I personally worked very hard at it. And I remember once as an intern that I had a patient who had leukemia. Well, a parent's child who has leukemia, they're all already wiped out. But this kid was 7 years old, and he was not going to. He just carried on, and he wasn't going to let me stick him. But it wasn't me totally. It was the fact that he wanted to make sure that he didn't want to be stuck by anybody, and so I started to. My feelings were hurt so badly. I started to go and ask somebody else to start the IV, and the mother hen in me stood up and said, I said, listen, I said, if you lay here, don't move, it'll be one stick. I said, but if you dare move, I said, it may take me 30 times. And I said, so, yeah, and I said it was real authority. And he laid it out of his arm, and I don't think that child even breathed for the next minute. And God took care of me because I happened to get the IV in on the first stick. But what I'm saying is, he was not going to let a nigger stick him. But it wasn't me. It was he didn't want anybody to stick him. But after that, I had no more trouble out of him. But had I laid it down and gone and gone and gotten somebody else to do it, I would have been doing that for the rest of my internship.
Thank you so much, Dr. Elders. We have another question from Sarah here.
Okay, Sarah.
Thank you so much, Dr. Elders, for speaking on everything. Everything you've said is like so insightful. One of my main questions is like, how do you recommend us as like future providers or current providers like check our own biases and like continue to learn from that and grow in that way?
I think that we have to learn from our own biases by asking ourselves. We have to question our own selves, question what we did, and question whether we really, whether this was really the best and in this patient's best interest. And we have to make sure, because we'll be walking around being biased and even saying things that are biased and not even be aware of them until sometimes later. So we have to be conscious of our own internal biases all the time.
Thank you so much.
You're welcome. I don't know if I knew the answers to all your questions. All of you know that that we still wouldn't have all of these implicit going on in the country, and we would have gotten rid of all of them by now. But we know we still have a lot of diversity, a lot of implicit and explicit biases going on, and we have to work on ourselves to get rid of those implicit biases. And the only way we get rid of them is become aware of them. You aren't going to ever get rid of them if you don't realize you have them.
Yes, ma'am. Very true. Thank you, Dr. Elders. Let's see. Another question we have is, how do you recommend incorporating implicit bias training into medical education?
We have to talk about it. We have to admit it, accept it, and talk about it. And we have to just, we have to just, as long as we don't admit it, we'll never do anything about it, and it'll never change. And not once we admit it, we've got to accept it. We can't just admit it and say, "Oh yeah, I know, I know, I hate Black people." But we have to just start asking, why do we hate them? Why do I feel like this? And start analyzing it and working on yourself. And I think that's the only way we make a difference.
Let's see. Thank you, Dr. Elders. One more question I have is, can you discuss a case or a scenario where implicit bias influenced a patient's treatment or course?
Well, if we really go back, and you have to remember, I haven't doctored in 30 years, so I really, I had loads of them back then, but I think that very often implicit and explicit bias very much influence the treatment of Black people with hypertension in the South. Therefore, we have so many with high blood pressure. We didn't, we didn't really, we felt we couldn't take them off their diets that they were on because they didn't have anything else to eat. And so, and to me, that's influencing their treatment. That's influencing their blood pressure. That's influencing whether they're going to die with cardiovascular disease. And we know the most common cause of death. Well, we know, first of all, that Black people were likely to die earlier. The most common cause of death is for all of us is cardiovascular disease, diabetes, high blood pressure, and they're often because of their diet. And often their diet is because we don't educate them. We need to start educating them very early on what's a good, healthy diet. And exercise. That we really need to start early with diet and exercise to really make a difference. Y'all know much more about all of this than I do now. Things have changed so much. You have to remember, I haven't doctored in 30 years. But I'm so proud that all of you all are coming along and going to make a real difference and trying to keep us healthy. You have to be aware of the fact we don't want to just live longer. We know we're living longer. We want to live better. And so if I can't live healthy, well, what's the point in living? So you're going to make sure you do the things to make me healthy or keep me healthy.
Yes, ma'am. Thank you so much for your talk today. We are all honored to have you speak. It was a real treat and pleasure for us.
Thank you for having me. Your questions woke up my ability to think about it again. And so it was a real pleasure. And I really enjoyed having the opportunity to speak with you.
Dr. Elders.
Yes, hello.
Hi. I actually have a question that is
okay.
It's adjacent to implicit bias, but it's more so talks about diversity. So when we talk about implicit bias or biases and enforcing, like the providers that enforce these, unjust thoughts and unjust treatments and unjust patient care in general, what is your definition of diversity, being that you've went through so many changes in society in general? So from the start, I guess, of your medical practice till now, what is your definition of diversity, and how do you feel like that has changed over time? And where do you see it kind of projecting in the healthcare field?
I don't know what my definition of diversity is. It's to diverse is mean that we're having many diverse populations, and diversity in terms of sex and size. We treat obese people very different than people, black, white, all of our gender, all of those are, and we all have different feelings about different aspects of that. And I feel that we've come a long, long way. We made an awful lot of difference, but we still have a long way to go. We're more aware of our feelings now than we were in the past. Well, we were maybe aware of them. We're more likely to admit them and talk about them now. Before we didn't say anything about them. We just felt that it was all right, however we behaved and however we treated someone. So our gender biases, our racial biases, in fact, I'm reading a book right now, CASTE, CASTE, and it's kind of goes with the origin of diversity and biases from all over, from the beginning, where it all started, and how in comparison with India's caste system. So it's really been a good book, but it's makes me more aware of what's been going on.
I feel like that's very well said. I feel like a lot of people kind of put a cap at diversity when they talk about, oh, just race, sex, religion. The most they'll go is religion, but there's cultural diversity, there's diversity in thought, diversity in opinion, there's sexual diversity, age diversity.
Absolutely. And with disabilities, people with we treat people with disabilities different.
It's funny that you say that. Sorry, guys. I just have to kind of plug this in. We have in my PA school, like a schedule where we have a, what is it called? Challenging patient. And one of them was actually and it was a way to check your own biases, actually.
Yes.
One of the patient had cerebral palsy.
Yes.
I guess it wasn't more so like an experiment. It was more so for us to kind of realize afterwards, after we went through that situation, to realize how we were treating that patient.
Right.
Were we talking softly in a specific way, in a specific manner? Were the way we were using our hands? Were we like trying to explain things while also using our hands? Like you think you're doing sometimes the right thing, but you've never been in that patient's shoes. You don't understand that within itself, certain things that you do is biases. So like you said, the best way to go about it is to check yourself first, and then also, implement it with your patient care. Thank you so much, Dr. Elders.
Thank you all for having me. You've done more education on me than I have of you, so thank you.